Dr. Lee Hyer, you're a professor of psychiatry at the Mercer School of Medicine and professor at the new Mercer Graduate School in Clinical Medical Psychology. You're also the author of Psychological Treatment of Older Adults, a Holistic Model. What makes this book significant?
Yeah, it's kind of a haughty title. This book, I think, is significant because of what I have come to observe over the last couple decades, and that is that we have a lot of evidence out there to suggest that we can deal with older adults in much better ways, but we don't apply it. And I saw this book as an opportunity to isolate variables that are modal problems for older folks, and to do it in such a way, I think, that we can borrow from the evidence base that's out there and the practical clinical needs of these people and clinicians applying these. I just have read too many papers where evidence base was mentioned and there was a clinical significance and the nuance of this particular technique. And when you applied this to the real world with older adults, it just wasn't connecting. About a year or two, I guess 3 years ago now, Ben Mass did a nice book on dementia. The whole person was isolated and targeted, and did a nice job on the holistic understanding of a person with dementia. And we're not talking about dementia specifically in this book, although we address it considerably. But the idea is that you need to have a just sufficient information of the core variables that go into an understanding, the best understanding, to treat older adults that are in fact different from adults and certainly from kids.